Another day, another video of first aid by Benign Fasciculation Syndrome, causes, symptoms, diagnosing, and treatment. Benign Fasciculation Syndrome, BFS, is a neurological disorder characterized by persistent muscle twitching and cramping. Symptoms of BFS can include fasciculations, muscle twitches, cramping, tingling sensations, numbness, and pain in the affected area. While there is no known cure for BFS, there are treatments available that can help manage symptoms and reduce the frequency and intensity of the twitching. What is Benign Fasciculation Syndrome? Benign Fasciculation Syndrome, BFS, is a neurological disorder characterized by twitching of various muscles in the body. It is also known as benign fasciculation disorder or muscle twitching syndrome. Symptoms of BFS include involuntary twitching or spasms in different muscle groups, such as the eyelids, arms, legs, torso, or face. The twitching can occur intermittently or continuously, and is often accompanied by a sensation of tingling or numbness. BFS is not life-threatening and should not be confused with other neurological disorders, such as amyotrophic lateral sclerosis, ALS. In most cases, BFS is not caused by an underlying medical condition, and can resolve on its own. Treatment may include lifestyle changes, medications, and physical therapy to reduce muscle twitching. Causes of Benign Fasciculation Syndrome. Benign Fasciculation Syndrome, BFS, is a disorder of the nervous system in which the person experiences muscle twitching, cramping, and fatigue. The exact cause of BFS is unknown, but there are many factors that may be involved in its development. These include genetic predisposition, viral infections, and nerve damage. Certain medications, such as those used to treat epilepsy and Parkinson's disease, may also trigger BFS symptoms. Stress and anxiety can also lead to an increase in muscle twitching. In addition, electrolyte imbalances, dehydration, and vitamin deficiencies can all contribute to the development of BFS. It is also possible that BFS is caused by an underlying neurological disorder, such as multiple sclerosis. Symptoms of Benign Fasciculation Syndrome. Benign Fasciculation Syndrome, BFS, is a neurological disorder characterized by muscle twitching and cramping. The primary symptom of BFS is recurrent, non-painful twitching of various muscles in the body. The twitching may be localized to one muscle group, such as the eyelids or calf muscles, or may involve multiple areas of the body. In some cases, the twitching may be accompanied by cramping or aching of the affected area. Other symptoms of BFS may include fatigue, muscle weakness, insomnia, and depression. BFS is not life-threatening and does not typically progress to a more serious condition, but it can be uncomfortable and disruptive to daily life. Diagnosing Benign Fasciculation Syndrome. Diagnosing Benign Fasciculation Syndrome, BFS, can be difficult due to its similarity to other neurological disorders. Generally, diagnosis is made through a combination of neurological and physical examinations, as well as patient history. The neurologist will likely order tests such as electromyography, EMG, and nerve conduction velocity, NCV, to examine the electrical activity of the muscles and nerves. The doctor may also order laboratory tests, such as a complete blood count, CBC, to rule out other conditions. Additionally, imaging tests such as a magnetic resonance imaging, MRI, may be used to look for any structural abnormalities. Ultimately, BFS is usually diagnosed through exclusion of other potential causes. Treatment for Benign Fasciculation Syndrome. Benign Fasciculation Syndrome is a rare disorder that can cause muscle twitching, cramping, and fatigue. Treatment for Benign Fasciculation Syndrome aims to reduce symptoms and improve quality of life. Treatment options include medications such as antispasmodic agents, muscle relaxants, and anticonvulsants. Additionally, lifestyle modifications such as stress management, adequate rest and exercise, and avoiding caffeine and alcohol can also be beneficial. Physical therapy may also be recommended to help with muscle strengthening and relaxation techniques. In some cases, botulinum toxin injections can be used to reduce muscle twitching. Lastly, relaxation techniques such as yoga, tai chi, and meditation can be helpful in managing stress and anxiety. Benign Fasciculation Syndrome versus ALS. Benign Fasciculation Syndrome, BFS, is a condition characterized by twitching in the muscles of the body that is not associated with any other neurological disorder or disease. The twitching is usually painless and can occur in any part of the body. The cause of BFS is unknown, but it is thought to be related to stress. BFS is a benign condition and is not life-threatening. ALS, amyotrophic lateral sclerosis, is a progressive neurological disease that affects nerve cells in the brain and spinal cord. It causes muscle weakness, difficulty speaking, difficulty breathing, and eventually death. There is no cure for ALS, and the cause is not known. ALS is a life-threatening condition that affects thousands of people every year. Outlook for Benign Fasciculation Syndrome. The outlook for benign fasciculation syndrome is generally positive. While the condition can be irritating and uncomfortable, it typically does not cause long-term damage or disability. In most cases, the symptoms of benign fasciculation syndrome will improve over time with proper treatment. Treatment typically includes avoiding caffeine, decreasing stress levels, and taking medications to reduce muscle spasms. Additionally, physical therapy and lifestyle changes may be recommended to help alleviate symptoms. With the right treatment plan, most people are able to find relief from their benign fasciculation syndrome and return to their normal activities. In conclusion, benign fasciculation syndrome is a disorder that affects many people. It can be a source of anxiety and discomfort, but with proper management and treatment, it can be managed. It is important to speak to your doctor if you are experiencing any of the symptoms related to benign fasciculation syndrome and to discuss your treatment options. With the right approach and management, it is possible to manage the condition and reduce the impact it has on your daily life.